Our research is about nurses' safety attitudes as perceived by geriatric patients in home care institutions. COVID-19 pandemic has brought bizarre challenges and an incommensurate threat to humanity, especially to the geriatric patients' lives, relationships, and well-being. With the spread of the new coronavirus and its impact on human health, no one knows how long this pandemic will last and its long-term toll on geriatric patients living in a confined environment such as home care institutions. The lack of information available within the literature necessitates the importance to negate the effects of the COVID-19 pandemic, which may impact quite negatively on geriatric patients' care inside home care institutions and the higher mortality rates for older adults. It can be noted that geriatric patients in home care institutions have an even higher risk of getting infected with COVID-19. This is due to old age that they are no longer able to perform daily activities. The normal process of time-related change in every individual begins with birth and continues throughout life. This includes the aging process, where process of its spontaneous changes such as physical, emotional, psychological, social, and economic aspects occur as part of human life development. It is a natural process that presents a unique challenge for all sections of the society. Psychosocial theory states that genetics is not the prime determinants of aging. Factors such as lifestyle, personality, and environment plays a major role in its process. Because old age is a normal occurrence that encompasses all experiences of life, care and concern for the geriatric patients cannot be limited to one discipline, but it is best provided through a cooperative effort. An interdisciplinary team through comprehensive geriatric biophysical and psychosocial assessment can combine expertise and resources to provide insight into all aspects of the aging process, thus provide a holistic approach to care. According to World Health Organization, multifaceted approach incorporating active collaboration of health, social welfare, rural and urban development, and legal sectors is needed for the prevention and control of health problems of the older persons. Here in the Philippines, Filipino older persons account for 6.9% of the population, according to National Statistics Coordination Board of the Philippines. By year 2040, it is projected that out of 141.7 million Filipinos, they will be approximately 19.6 million. According to Viola in 2011, indeed the share of older persons to total population has been steadily increasing over time, and the average age of the Filipino has also been increasing. This means more geriatric patients will be needing quality care from their family as well as from their healthcare providers like the nurses. This is due to the fact that as people age, they may encounter psychological, social, environment, and physical changes that may affect their life, according to Beliran and Legaspi in 2014. According to the same authors, pathologic changes coupled with progressive age related changes may lead to decrease in function that can influence one's comfort, independence, and freedom from pain, and cognitive and physical function. In the study made by Cheng Chen and Su in 2012, they reported that there is weakening of both physical and mental functions for the geriatric patients because of the aging process, which leads to a weaker performance and higher rates of disability and death in the elderly. According to Nayeri, Golizade, Mohammadi, and Yazdi, Geriatric patients are prone to complications and problems such as delirium, motor disability, sepsis, pressure ulcers, poor nutrition, fall, incontinence, and thrombolytic diseases. Other health-related challenges that may occur to them include several chronic illnesses at the same time. Atypical manifestations of acute illnesses, the need for additional support for everyday activities, polypharmacy issues, and frequent use of healthcare services, according to Rush, Hickey, Epp, and Janke in 2017. These findings were intensified by studies from different authors that showed that, based on empirical observations, geriatric patients inside home care institutions receive variable quality of care because of clinical and organizational factors. That 47% of homes have no provision for chronic disease management for geriatric patients, such as rehabilitation or physiotherapy, and others have only minimal levels, even though many patients could benefit from the latter. Pain and symptom control is often poor as a result, according to Miller, Teno, Moore, and in 2004. And there is some evidence of inappropriate medication. With all these conditions happening to geriatric patients inside home care institutions, it is therefore noted that it is important to ensure that these geriatric patients are well protected and provided with the necessary support throughout the different phases of the pandemic. According to Macaron et al. In 2020, healthcare providers, such as nurses, and their safety attitudes towards care for the geriatric patients should be geared towards becoming mindful that geriatric patients are particularly vulnerable as a consequence of being socially isolated. Financial hardships, complications in acquiring the needed care and supplies, and anxiety about avoiding COVID-19. This is because nurses are the frontline caregivers. Their regular systematic observation of their geriatric patients' status gives opportunity to recognize problems at hand. In lieu of this, the researchers were motivated to pursue this study in order to explore and determine the nurses' safety attitudes as perceived by the geriatric patients in home care institutions.
The methods of this study utilize the descriptive type of research, specifically the descriptive correlational design to determine the nurses' safety attitudes as perceived by 245 geriatric patients living in home care institutions within Metro Manila. The data were gathered using an adaptive and modified questionnaires entitled Nursing Home Surveys on Patient Safety. From this research, study of Albin C. Ogalesco and Janet B. Lim of University of Texas, whom the authors were asked permissions for its use. According to Pollock and Betts, 2010, a correlation is an interrelationship or associations among variables that is a tendency for variations in one variables to be related to variations in another. The purpose of correlational research, like experimental research, is to understand the relationships among variables, but without manipulation of independent variables.
The results of this study include the following. Table 1 shows the demographic profile of the geriatric patient respondents. In terms of age, the highest belong to ages 60 to 69 years old, with 44% or 108 out of 245. The lowest is those belonging to more than 80 years old and above, with only 20% or 49 out of 245. This suggests that the respondents were mostly under young older persons' age. In terms of gender, 60% comprises the female population, while 40% comprises the male population. This finding indicated that female dominates the population of the geriatric patient respondents of this study. In terms of civil status, most of the geriatric patient respondents are married with 52% or 125 out of 245. The lowest was the single ones with only 4% or 10 out of 245. In terms of length of stay in the institution, most of the geriatric patient respondents have been there for 0 to 9 years or 56%. Others were living there for 10 to 19 years with 40%, and lastly, 10 or 4% of the respondents have been there for 20 years and more. Table 2 shows the nurse's safety attitude in the institutional home care setting as perceived by the geriatric patients in terms of cognitive aspect, with an overall mean score of 3.46 interpreted as very much evident. This indicated that the goals to preserve cognitive functional capacity of the geriatric patients have been greatly met evidently. With this kind of caring attitude by the nurses, the geriatric patients will not burden so much by cognitive limitations that limit their ability to hear, see, and or understand their medical circumstances. This will help in their improved function, independence, and quality of life, especially now in times of COVID-19 pandemic. This finding is supported by the works of Bell, Patel, Sunani by Eka Foreman in 2016, which reported that patient-centered goals of care for geriatric patients are critical to the personalized treatment approach for each patient. The authors added that geriatric patients do not necessarily desire longevity as a sole outcome, but they also have expectations about modifying pain, independent life, or increasing function. This finding is also supported by the works of Gassman, which reported that care is a reciprocal practice occurring within a framework of a relationship between the nurse, caregiver, and patient care receiver. Table 3 illustrates the nurse safety attitude in the institutional home care setting as perceived by the geriatric patients in terms of affective aspect, with an overall mean score of 3.45 interpreted as very much evident. This suggests that the goals to preserve behavioral, affective capacity, affective reactions, beliefs, and knowledge, and a specific behavioral responsive of their geriatric patients have been greatly met evidently. But this kind of caring attitude by the nurses means that they understand how the social environment affects the behavior of the geriatric patients. With these attitudes, nurses can easily get the cooperation of the geriatric patients in terms of having social activities as part of their treatment regimens. Table 4 presents that nurses' safety attitude in the institutional home care setting as perceived by the geriatric patients in terms of psychomotor aspect, with an overall mean score of 3.43 interpreted as very much evident. This suggests that the goals to preserve psychomotor capacity, physical skills such as movement, coordination, manipulation, dexterity, grace, strength, speed, actions, which demonstrates the fine or gross motor skills of the geriatric patients have been greatly met evidently. With this kind of caring attitude by the nurses means that they acknowledge the importance of the relationship between cognitive functions and physical movement of the geriatric patients, that the demonstration of their physical skills such as movement, coordination, dexterity, grace, strength, and speed are part of the factors that can affect their basic routine activities.
Table 5 illustrates the nurse safety attitude in the institutional home care setting when grouped according to age. It shows that there is no significant difference between the nurse safety attitude and their level of care when grouped according to age as determined by the p-value of 0.072. This indicates that regardless of age, nurses perform same safety attitude to their geriatric patients. Whereas Table 6 shows that the nurse safety attitude in the institutional home care setting when grouped according to gender. The table data presents that there is a significant difference between the nurse safety attitude when grouped according to gender, as determined by the p-value of 0.034. In Table 7, presents the significant difference between the nurse safety attitude in the institutional home care setting when grouped according to the status, as determined by the p-value of 0.002. And lastly, Table 8 shows that the significant difference between nurse safety attitude in the institutional home care setting when grouped according to length of stay in the home care institution, as determined by the p-value of 0.005. The finding means that the nurse vary in their ways on how to manage the care they give to the geriatric patients according to the time they spent in the home care institution.
For the conclusion, it was concluded that there is a very much evident nurses' safety attitude as perceived by the geriatric patients in terms of cognitive, affective, and psychomotor aspects, and that there were significant differences between the nurses' safety attitudes when the geriatric patients are grouped according to their gender, civil status, and length of stay in the institution. Future research involving other nurses from other home care institutions from other locales is needed to establish more evidences about the nurses' safety attitudes in caring for geriatric patients in times of pandemic. For the recommendation, it was recommended that geriatric patients should view old age as an opportunity for continuous development, satisfaction, and well-being, and that nurses must always carry with them their best safety attitudes while taking care for them, keeping in mind all these characteristics, especially in critical times like the pandemic. Nurses to become more sensitive to the needs of the geriatric patients, focusing on counseling them to become aware of the necessary steps to avoid infection during the pandemic, accept their limitations and mental health management, family and relatives of geriatric patients to think that aging is a natural experience and must confidently learn how to care and cope with their geriatric patients, especially during pandemic. Nursing education to emphasize on the teaching of student nurses on how to manage giving care to geriatric patients inside home care institutions in order to promote good and effective health interventions during the pandemic.